Welcome, everybody. Thank you for tuning into the talk this afternoon that I'm going to give on contraindications and precautions for pregnancy. This is a talk that I usually give when I do our 20-hour trainings, and it takes about 3 hours. So I have tried to compile everything into one single hour, which should be interesting. I'm going to talk fast and do my best. And I think because of that, the questions at the end are the best. So I have been an R.M.T. since 1985, so I'm in my 35th year. And I also have formed a company called Trimesters Massage Therapy Education in 1995. And our company, the main goal of our company is to teach anything baby, mommy, birth related. And so we have been successfully doing that for the last 25 years, and also have worked in one of the major hospitals in Toronto, teaching CCMH students within the perinatal units. So they're working with the high risk pregnant moms. They're working with labor and delivery, postpartum, and yeah, it's an amazing course. So my information is up there. You're welcome to call me, to go on the Trimesters Facebook page. We keep that updated. My website's woefully out of date and is in the process of being the new one uploaded, but I have no idea when that's going to happen. So Facebook, it makes more sense in terms of seeing what we're doing actively with Trimesters, okay? And my email is up there as well. So let's see if I can get this happening here. Okay, so I wanted to try and encapsulate the most vital information that I thought you would need in terms of contraindications and concerns about pregnancy massage. And it is one of the most consistent questions that people come to our courses with, their fears and their myths and their concerns about what's safe for pregnancy. Can they hurt a pregnant woman? Can they cause a woman to go into labor? And I'm here to hopefully dispel lots of your fears and worries about that. So I just put a slide up here that says, what do you know and what don't you know? I usually, when I'm working with groups, ask them directly, what are the fears you have? And then we have usually a full whiteboard full of queries that people are asking. So if you're coming into pregnancy fairly new in your love of this work as an R.M.T, then there may be lots that you need to know. This may be a refresher for some of you. However you're coming in, you're welcome, and I hope you enjoy it. So another question I like to ask is, did you have good training when you were in massage therapy school? One of the reasons that Trimesters was formed was that we found that the level of training throughout Canada was very diverse, from really excellent training to almost none, from training that was a real pathological based model. And most of my training initially 25 years ago was in the US. So we wanted Canadians to have great skill set in terms of teaching, in terms of treating pregnant clients. So did you get good training in your school? And that to me means you actually got a chance to put your hands on pregnant people in a clinical setting. Have you done any postgraduate training? There's definitely different courses out there. We would love you to take ours, but there's many options. A couple of other questions. Do you feel that you treat your pregnant clients safely? Of course, do no harm is our big motto. And these days, many pregnant people have incredible fear, which is so sad and ironic when we have more technology and more skill in many ways related to the perinatal realm than ever before. And are you confident when you work with pregnant clients? If you're not, take a course, immerse yourself in it, and get confident working with those people who are so amazing. So are you afraid to treat your pregnant clients, or do you think that you do a good job addressing their needs? Those are a couple of questions to address. You may think that's a weird question because most of us think we do really good work, but every day I get calls from clients, from primary care providers, from midwives, from childbirth educators who share concerns and complaints about the massage therapy that their pregnant people are getting. And that makes me really sad. So I want everyone to rave about the work that we each do with our pregnant clients. So to contraindications and precautions. I'm dividing this hour up into 6 segments because I think these are the most important things that you need to consider in terms of working with pregnant clients in a safe way. So health status, their medical histories, do they have any pre-existing conditions? Do they have any obstetrical conditions? Do they have a perinatal history of loss or preterm labor? What is their level of risk? And that's not my word that I'm using. That's the way clients are talked about when they're pregnant. Are they high risk or are they healthy, normal, no risk kind of categories? We're also going to talk about trimester and gestational age. Some people are afraid to work with people in the first trimester. Some people are afraid to work with people in the third trimester. Usually the fears that I hear about that relate to either causing some kind of miscarriage or making the baby come early in the third trimester. It's not that easy for massage therapists to get a baby out of a woman's body. So I think if that's any reassurance right off the bat, I hope it is, but we'll go into it a bit more. The thing that I'm most concerned about when I work with pregnant clients, because I've worked with a lot of higher risk ones, is the systemic circulatory issues. So blood pressure for sure, also things like varicose veins and DVTs. Those are the concerns that I have most as an R.M.T. because we're working with the tissue in such a direct way. We're going to talk about positioning issues. There's raging debates in the perinatal circles about whether pregnancy tables are safe to use or not. I'm going to go over the varied positions you can have your pregnant clients in, and then you get to make a decision based on your own sense of safety as to what's good and what works in your clinical practice. Hydrotherapy, we'll talk about that, and then self-care for massage therapy clients. So that's a lot of information in an hour. So just quickly to go through when the Ontario government looks at pregnancy, they have categories: healthy pregnancy, no predictable risk. Of course, anything can happen to us at any time that changes us from a good condition to not so good. So, but I'm going to define healthy pregnancy in a minute so that you can understand the category of what kind of pregnant person fits in there. Pregnancy at risk, that is usually when there's some kind of issue, whether medical, usually medical, but it could be psychosocial, that puts a woman in a risk category. And then high risk is one where either the fetus or the pregnant person are in danger either with death or with some kind of disability. And they are the people that may end up in the hospital on bed rest and sort of doing the waiting game in the hospital units until it's safe to deliver their babies. I want to just do a shout out to some of my students. These are several groups of my CCMH students. Many of you know that CCMH is no more in Ontario. And for 25 years, I taught hundreds of these wonderful year 2 students in the hospital, working with the most difficult clients and the most amazing, I should add as well. And the work that they did to keep women who were stuck in bed happy. And you can see, of course, the joy on these faces as well. It was an amazing, amazing placement for the students. So shout out to them. So let's talk about health status in terms of case history. Most of us on our regular case histories have a question that says, are you pregnant and what is your due date? That's kind of the standard information we ask pregnant people. And as far as I'm concerned, that's completely inadequate for the situation. So my regular case history with anyone who comes through my door right now is 4 pages long. If I know you're pregnant, I will add a 5th page to my case history. So the more information you can get from your clients, it shows them that you're interested. It shows them that you understand the importance of their health history, and it'll make them feel more confident in you. I don't know how easy this page is to see, but I'm happy to email it out to any of you who want it after this session. So the standard things about where they heard about us and so on, but that will also be on the main form. So this is not a substitute for your regular case history. It's an add-on. So do they see an obstetrician, a family physician, a midwife? How often do they go? That's an indicator of their health status. If they're in a higher risk condition, they'll be seeing their obstetrician more frequently. If they are low risk, if they've checked midwife, you know they're in a low risk category because that's the perimeter of what midwives take for clients. Number of weeks pregnant and when their due date is, do they have any other children? That doesn't have to mean from their physical body. It could be a blended family. So I ask that question in a very broad way for clients to answer. Do they have any issues related to the pregnancy? Any muscle concerns related to pregnancy? Numbness, tingling, blood pressure issues? And if they do have any sensory issues, where are they? Many women don't know what their current blood pressure is, but I asked them when their last appointment was and if the practitioner said anything about it. If they didn't, it's in a normal category. And are they seeing any adjunctive professionals like chiros, physios, naturopath, acupuncturists? It could go on and on. Are they exercising during their pregnancy? And if so, what are they doing? This helps give you information about how potentially your pressure, the techniques that you are using with them. And then are they planning to have a hospital or a home birth? Are they thinking of having a doula or a labor support provider? And these last questions you may not find relevant, but if you are an R.M.T. who wants to do some labor support or doula work, these are good questions to ask. It may strike their interest. So case history information, of course, is vital. Do they have any past histories of injury, physical pain, or musculoskeletal dysfunction? What's their medical history? Have they had difficulty getting pregnant? Have they had any losses? We want the history, and we also want specific to the particular pregnancy. And then has the client had experience with massage therapy in a pregnancy context or before or after a pregnancy? What are their goals of treatment? The reason why I like to know if they've had pregnancy massage before is because I like to know what their experience was like. We once had a woman who came to a student clinic and said that she went to an R.M.T. who basically told her she had to be in a face down position because the R.M.T. didn't like working in a side-lying position. So that is completely inappropriate. And when that client got a full body massage from a student in side-lying with good pillowing, she was awed and just said, you know, that other massage really did not feel good or comfortable for me. So again, medical issues is important. So here's the definition of a healthy pregnancy: no predictable risk. They've never had any complications now or in the past, complications such as bleeding, hypertension, premature labor. There's a whole list of them. I didn't put them all up here. They have no significant maternal medical disease, things like lupus, diabetes, high blood pressure, fibromyalgia, anything like that. They have had no prior perinatal morbidity or mortality. Morbidity, of course, again, means disability, and mortality is death. And I just want to define the word perinatal because lots of people are using it these days. This hour is about pregnancy clients and pregnancy massage. Perinatal, the word implies, peri means around or about, and in some of the obstetrical texts, they use it specifically to refer to the 28th week of pregnancy onward, and that goes into postpartum. So people banter words around without actually not necessarily using them appropriately. So when I use perinatal, I'm referring to pregnancy, birth, postpartum, sort of the whole shebang. When I'm talking about pregnancy, I use the word pregnant. And then in terms of a healthy pregnant woman, the fetal growth is adequate. So the baby is growing in accordance with the gestational age of the woman who's carrying the baby. So another example of a at-risk client, I've worked a lot with twins and triplets in my career, and these people are placed in a high risk category, even though this is a cousin of mine who, this is her at 40 weeks. She had her twin babies at term, and you can see she's quite grown in terms of those babies. You can notice on her right hand, she's got a brace on her hand. She had bilateral carpal tunnel syndrome, as well as the babes. And when she delivered afterwards, she had quite a bit of back pain, and she was diagnosed as having a fracture in one of her lumbar vertebra related to carrying the baby. So she had no complications per se that put her in her life in danger, but she certainly had some issues related to carrying the babies and the symptoms of pregnancy. So if we look at gestational age and trimester of the pregnancy, you probably all know there are 3 trimesters, first, second, and third, and a full-term pregnancy goes to 40 weeks. So trimester 1 is 1 to 13 weeks, trimester 2 is 14 to 26 weeks, and third trimester is 27 to 40 weeks. I meant to put the source on this. Childbirth Connection is an amazing website, and they have all these lovely, lovely sagittal views of the pregnant person from preconception all the way through to delivery. So if you're a visual person, I highly recommend you check out Childbirth Connection. So in each of the trimesters of pregnancy, what we need to think about is the physical and the emotional realities going on for the client. And with respect to that, how do we need to consider our treatment, what we're going to do, how we're going to do it, and any adaptations that need to be made. And of course, contraindications comes into that. So does the gestational age or trimester influence what can be done when massaging a pregnant woman? Lots of people have a lot of fear around first trimester, whether that's the client or RMTs. So what I would like to say is the reason for the fear in the first trimester is because in weeks 1 to 13, that is the time frame when miscarriage most commonly occurs. And any loss before 20 weeks is called spontaneous abortion. You've got the SA there, and that's SA and miscarriage are some synonymous terms related to a pregnancy loss. Most losses in the first trimester are due to a chromosomal anomaly. So it's not because a woman ate something or ran a marathon or didn't eat properly or had some margaritas or had sex or worked late. It has, in most cases, nothing to do with the pregnant person's behavior. It has to do with the fact that the genetic material in the combined fetus is not viable for living. So that should actually reassure many of you who are afraid of massaging a woman in the first 13 weeks. When I talk anecdotally to RMTs who do a lot of pregnant work, if they know that a woman is pregnant in first trimester, many of us avoid doing abdominal work, just as you'll hear me say over and over again, erring on the side of caution. The issue for so much of our work in massage therapy is that there's no evidence to show one way or another what is effective and what isn't. And I know of no evidence whatsoever, no studies, no anything that has said anything that a woman in her first trimester lost a baby in the first trimester. So if any of you want to challenge that, please let me know. But I think that alone should give many of us a sense of peace around the possibility that there's nothing that I can think of that we could do as appropriate massage therapists that could cause a miscarriage for a client in first trimester. Our main goals in first trimester, there are some particular things that I think we do need to consider in terms of first trimester, because often women have particular symptoms in that first trimester, things like great fatigue, breast tenderness, nausea and vomiting. They also are getting used to the whole notion of being pregnant. So whether it's a surprise or whether it's been deeply wanted, they have emotional feelings about that. They may be hiding the pregnancy until they do get through the first trimester, especially if they've had losses, or they may not want their employer to know. So you may be one of the very few people that a client discloses that she is in fact pregnant and in that first trimester. Contraindications to massage, the one that I could think of would be abdominal massage if a woman has any bleeding, abdominal pain, nausea, vomiting. Other than that, full body massage in first trimester, dependent on the client's health history, should be absolutely fine. And again, what I'm saying to you is not carte blanche, go for it. It's you need to check the case history to make sure that the client is well when you massage her. And that does include if she discloses any of her previous perinatal history as well. So you are a partner with this client in helping her get used to the notion that she is pregnant, and she's hopefully going to be coming to you throughout her entire pregnancy. Second trimester, often it's considered a time when women feel the best out of the 3 trimesters. The energy comes back. Often the nausea and vomiting is diminished, and baby's starting to move and kick and becomes more of a reality. And so again, it's usually a time of well-being for most women. And that's, again, generally speaking. Third trimester, and I'll go back to second trimester. Again, full body massaged is absolutely fine. Usually I pose the question about abdominal massage around 22 to 24 weeks. At that point, the baby is out of the pelvis into the abdomen, and at 24 weeks, the baby should be at the level of the belly button. So there's a baby in that tummy to actually work with in terms of abdominal massage. Third trimester, 27 to 40 plus weeks. In Ontario, most women are not allowed to go more than 12 days post 40 weeks. There is some studies, which I haven't seen, but the indication is that after the 40 plus 12 days, the fetus is not, the placenta is not functioning as optimally as it is prior to that. So you may see that that's when the questions start to come up about induction and kickstarting labor for mother. Here's a picture of my friend at 40 weeks, one baby. He was a nice 10-pounder. But you can see how incredibly beautiful and sizable a full-term belly is. And you can see on the left, the pictures show some of the ligaments that are involved in creating sometimes discomfort for the pregnant client. The round ligament is that long, stretchy one in the front. It can often cause sharp shooting pain in a diagonal line, and it can go from sort of the top of the uterus into, or the middle of the uterus into the groin area. It often gets triggered when a woman is getting up out of a seat or rolling over. And it's usually occurs around the time, I would say around 6-7 months, when the belly is starting to enlarge, and that you can just see the profound stretch on that round ligament. And of course, anything that refers pain into the groin area is scary for women. So it's important for you to know that a round ligament can cause that one-sided discomfort. The broad ligament that is cut there, but it wraps along the side of the uterus, can cause some symptoms that are similar to sciatic or glute discomfort. And the one on the far lower right, the uterosacral ligament, connects exactly what it says, the uterus to the sacrum. And so if a woman is having low back pain and you feel like you're not finding anything in the actual musculature, it could be from some strain on the uterosacral ligament. So there's what pregnancy looks like at full term. And we want to make this process as beautiful and as healthy and as happy as we possibly can. So again, third trimester, the client is gaining as much as 1 to 2 pounds per week, and mostly on the interior side of the belly of the body. So you can see the increased lumbar curvature there. Her whole center of gravity has changed because of the anterior pull in the front. I think she's got a little bit of knee locking. We can't fully see, but I think so. And for this client, what was her salvation and joy was getting in water and swimming and just floating. And any of your clients who need some exercise during pregnancy, I highly recommend, especially summertime, get in a lake. It's an awesome way to help with the hydrostatic pressure of edema. It helps women feel buoyant, and that heaviness related to their belly is relieved while they're in the water. So going on now, we're going to look at the systemic circulatory issues that, as I mentioned before, edema and blood pressure are the primary ones. Just a quick physiology lecture, and the major points are in blue up there. So number one, increased blood volume of 30 to 50%. That's a lot of increased fluid in the pregnant person's body. Increased interstitial fluid volume, you know what these translate to. We're talking edema. And then this is also a really important one. Number 5, a change in the clotting capacity. And what this means is that there is an increased risk in pregnant people of having blood clots form, or DVTs. And the increased thrombus formation is actually a good function in the birthing woman because it prevents her from bleeding to death when she is in labor. But because of this decrease in the fibrinolytic activity, which dissolves blood clots, she may develop clotting issues earlier than the birth. So we need to be aware of things like varicose veins and DVTs. Some of the warning signs of blood pressure, the fundamental ones for us as R.M.Ts would be headaches, visual disturbances or impairments, and right upper quadrant pain is also another indicator that often in the hospital they will be asked that because it could indicate some involvement of the liver. Number 3, protein in the urine. Of course, we don't do lab work, so we can't be mindful of that. But every time the pregnant person goes for a checkup, she will have her urine tested to make sure there's no protein and no sugar in the urine. I've put sudden edema as number 5, and many people would think of edema right away when we're talking about blood pressure. But in fact, the Society of Obstetricians and Gynecologists developed this 60-page tome on blood pressure in pregnancy. And they suggested that because edema is so common in the pregnant person, 75% of all pregnant women have an increase with swelling. So they don't consider edema as a sign of blood pressure issues unless it's a woman gains over 2 pounds per week. And that is indicative of they would be doing other tests as well. So swelling of the ankles, hands, fairly normal. If you have a client who has edema in the face, that one I would really encourage them to get on the phone and talk to their primary care provider, because that is less common than ankles, hands, feet. And dizziness and nosebleeds, I have to say I've never seen a client who has high blood pressure who's spoken of either of these, but they're on the list. So if you have a client who comes in with any of the factors from 1 to 8, then you need to be sending them to their primary care provider. I know that many students are doing blood pressure readings when they're in school, and then when I ask R.M.Ts how many are taking blood pressure, the hands drop really quickly. We're so busy trying to get a client on the table for as much time of treatment as possible. But if you have the capacity, you've learned blood pressure taking, it's always a good idea to do a pre and post blood pressure with your clients who are pregnant. You may be the one that discovers an issue that they need treatment for. Positioning issues for safe massage therapy treatment. What are the options? Well, the ones that I've put down are supine, prone, side lying, semi-reclining, and forward leaning. The issue, these are appropriate for people at different times throughout pregnancy. So the question becomes, when are they appropriate and when are they not appropriate? And that's what we will be talking about right now. So supine hypotension, you should know this term if you're working with pregnant clients. What this means is that when a woman is lying flat on her back, usually second or third trimester, as the gravid or growing uterus compresses down on the woman who's lying flat on her back, you can see the blood vessels there. The inferior vena cava and the aorta can be occluded by the weight of the baby. And the kinds of things that occur as a result of this is that a woman can feel faintness, short of breath. There can be a drop in fetal blood circulation. And it's a sudden onset, precipitous drop in the blood pressure. And I once had a woman who I was massaging her head and neck, and all of a sudden I was sitting and I had my eyes closed while I was doing it. And all of a sudden she let out a huge gasp and sat bolt upright. And she was very apologetic. She was like, I couldn't get my breath, and I panicked. And she was experiencing supine hypotension. So you only need to have that happen once to know that you don't want women in second, third trimesters with growing bellies occluding their blood vessels. It can also affect edema in the legs and varicose veins if women have them. And also, one of the quotes I've got here says it can also cause late deceleration in the fetal heart rate. So we do not want any of that. The schematic here is quite good. I think you can see the baby pressing right down on that those blood vessels. And then you see down in the right-hand corner what it looks like supine. And if you just get that mom to roll over on her side, it frees up those blood vessels and she's going to be just fine. So I really discourage supine treatments in second and third trimester. Sometimes you will see books that say you can have your pregnant client lie on their back for 5 or 10 minutes, but who decides how much time is okay? 5 minutes for me might be 10 minutes for you, or for some people, it might not be appropriate at all. So my hope is that you get comfortable doing side lying massage for the pregnant client. There's so much of the body you can access in a side lying position. And usually the reason why people don't like side lying is that they haven't learned good biomechanics and they haven't got the confidence to know how to do their techniques in a way that not only feels awesome for the pregnant client, but also awesome for the therapist. So we spend a lot of time getting you to practice side lying until you can say, yay, love this, it's awesome. The other thing some people do in a supine position is they put a little baby wedge or a rolled up towel under the right hip, which again will shift the gravid uterus off of the inferior vena cava. If you think about that though, so many women when they're pregnant have asymmetries in their body. They have SI joint issues. They've got symphysis pubis issue. And we're going to put something under their hip that's going to torque their body out of symmetry. And to me, I just find it's not worth doing for the short-term effect of you not wanting to have them on their sides. Excuse me, just taking a drink. With things like ultrasounds, the only way the technician can actually get what they want is to have that pillow under the hip and the woman in supine. So that's the one place where it's done routinely. So then if we think about prone, and when we think about prone positioning, we're thinking about belly sleepers, those who love sleeping face down, and then they get pregnant and they get a belly and they just loathe having to go into any other position than face down. So I'm showing you some pregnant bellies here, and I want you to think about, is it safe to have these bellies in a face down position? Now, some of you would say, yes, if I have a pregnancy table or a belly cushion. And again, this is for you to decide. Some people love their pregnancy table. I know of some practices that every massage they do, they use a belly cushion. Again, you need to think about when and when not. And some of the comments I've heard from clients about these devices is they're kind of like a hammock that the belly rests in. The issue is that not all women have the same size breasts or tummy. And so some women love them and some women don't feel comfortable at all with them. I frankly do not use either of these. And when my clients call up, or a new client calls up and says, I'd like to come to you because I hear that you work a lot with pregnant women and I want to lie in the pregnancy table and feel what that feels like to be in a face down position, I just frankly say, to tell you the truth, I work with many, many pregnant clients, but I do not use a pregnancy table or a belly cushion. I have you side lying with wonderful pillows to have you really supported well. And I also have a lovely wedge to put you in a semi-upright position, as if you're the same kind of position as if you're reading in bed. And in that respect, I can do your legs, your arms, your tummy, your breast, chest, head, neck, and shoulders. And it's really lovely. And usually they say, sure, let's try it. And I also explain to them why I don't like having my pregnant clients in a prone position. So here's the deal. If you have a 10-pound weight in your belly, maybe 6 pounds baby, a pound is placenta, a couple of pounds is amniotic fluid, and you have the woman in a downward position, that is a lot of downward weight along with gravity pressing into the hammock or the table or the pillows, whatever. Same as supine hypotension. If the baby and the weight is strong enough to be able to occlude the blood vessels, it's quite a force in the other direction as well. Women have issues again with ligaments, and particularly uterosacral ligament could be placed on more strain in a face down position. The clients who have an increased lumbar lordosis already, it might aggravate what's already aggravated in that area. And then you add the pressure from the massage therapist. And when I saw a schematic of this, I haven't got a diagram of it yet, that's when I went, I think I won't be using belly cushions to have my clients in a face down position. And I've never looked back. It's absolutely fine using side lying and the wedge for semi-reclining. So again, some of you may be listening to this and going, I use a pregnancy table and I love it, and that's fine. I'm not telling anybody whether they should or shouldn't use it. I'm telling you the reasons to consider why you might think twice about it, or what you need to inform your clients if you are going to have them in a face down position. Okay. Side lying, again, I think it should be the best and optimal position, but there's always a but. And this is the but. This was out of a massage therapy trade magazine, and it's side lying. So shouldn't that be great? But if you look at this slide, you can see the torsion throughout the side of the body into the belly, the fascial pull, as that weight of that baby is just like pulling all of that side musculature into the table. She has no pillow, I don't think, between her knees. She has no pillow to support her arm. And she's got this incredible concave profile in her thoracic region. So this is not a good side lying position for a woman to be in. So make sure you use lots of pillows. So here we have a body cushion that we are using for pregnancy, and we've pulled it apart. And this is awesome for the woman who has shoulder issues. Her shoulder fits and arm fits so nicely into that little concave space. And then look at how her leg, her hip, her foot are all in complete, beautiful horizontal alignment. This is a good position for side lying. Also, the belly has support with the body cushion. I might put a bit more support under it, but if she's comfy, that's good. You can do the exact same trough method with pillowing. So here she is looking just as comfy, baby supported on the pillow. She's got space for that shoulder, that achy shoulder. She's got space between her ear and her shoulder. And the only thing I'd probably add is another pillow under her arm for her to just wrap around. So side lying is awesome. You can do great work in side lying in the back with the legs. It's with the neck area. It's a great, great position to use. Here's the semi-reclining. And again, if you have a reclining table, yay, you're lucky, but you can also buy a big wedge. The midwifery texts say to put the wedge in a 45-degree position. I like 60. So I have the incline is usually 45 from the wedge. And then I add 2 horizontal pillows and 1 vertical pillow. And then I put a little baby wedge under her head with the wider side under her suboccipitals. And I always say to RMTs, once you've got her all pillowed, go around to the front and look at her face. And if she looks peaceful and happy and blissful, then you've got it done right. So this lovely pregnancy muscular fascial image here. What areas of the body are safe to massage during pregnancy and which aren't? The concerns are usually feet, low back, sacrum, and abdomen. I'm looking at my time. I have 5 minutes here. That's crazy. So for the legs and feet, you're thinking about edema, swelling, achiness, leg cramps, varicose veins, phlebitis, and the nasty DVT issue.
Cindy, can I pause you for a sec? You actually still have 20 minutes because you're good to go until 7:15. And there are a couple of questions. Do you want me to save them for the end?
Does it make sense to? Yeah, let's save them for the end. I think that's great.
Okay, cool. Yeah, you've got more time. Don't worry. Keep going.
You're like the generous timekeeper to me. Thank you. Okay, back to the anatomy coloring book. I just pulled this out of the deep recesses of my books. So the purple vein is the saphenous vein, and that runs the most superficial, especially around the knee region. The red is the femoral vein, and up top, the lovely lime green, my favorite color, is the iliac vein deep in the pelvic bowl. Those are the 3 veins that are most commonly involved in deep vein thrombosis. And because of the way they could be accessed, it's really the saphenous vein that it has the most DVT issues, and it's the most accessible to us as massage therapists due to its superficiality. So I would just say, be cautious when you're doing work in the adductor region and the medial aspect of the leg. Be mindful that that can be a sensitive area in terms of blood circulation. So can we do the legs? Can we work significantly on them? You see my fist there. You see us doing muscle stripping. You see us doing ringing. You can use your thumbs. You can use your forearm. Yay to leg massage. Again, this just summarizes what I said. The one issue that you want to consider with DVTs is that the common signs, of course, are heat, redness, swelling, pain, but DVTs can be asymptomatic. So that's not something any of us want to particularly hear. They're still teaching Hohensign in massage therapy schools, but that can give false positives and false negatives. So I really discourage you from doing Hohensign. If you're at all concerned with the potential for a DVT, send them to their primary care provider and they will get a Doppler to determine whether they in fact have a thrombus or not. Feet, yes, do feet. Please do feet. Many women who are pregnant are terrified to get their feet massaged, and they don't really realize it's two little points that are the culprits that are causing them so much fear. And those are the reflex points for the ovary and the uterus. It's a rare massage therapist that applies sustained, localized pressure on one spot for a long time in the feet, and certainly not to the uterus and the ovaries. So most of what we do is more in the Swedish massage camp. So I reassure my clients about that matter. We had a woman not too long ago in the hospital though, and she was seeing a traditional Chinese medicine person, and they said to her under no circumstances should she get her feet massaged because she was at risk of preterm labor. We explained what the consideration was, and we let her make her choice, and she still decided not to have her feet massaged, which is her prerogative. So that point is between the posterior inferior malleoli. If you draw a line from that to the heel, halfway in the middle is the point for the uterus and the ovaries. And I will show you that in a minute. But again, I want you to see from these pictures, I'm not sparing these feet at all in terms of the amount of pressure that I'm using on them. So this chart shows the points are number 56. And the way I remember this is that the outside of the ankle is the ovary and the inside of the ankle is the uterus. So really no strong sustained points there. I also want to really dissuade you from suggesting as an R.M.T that you can help induce labor. It's completely out of our scope of practice to make those claims. I know there are R.M.Ts out there who say they can kickstart labor and they've had great success, and it always makes me cringe because it's completely inappropriate for us to make those claims. It's not part of our scope of practice. The sacrum, basically, again, there's a lot of fear around the low back and the sacral area that if we do any deep work or fascial work, we're going to do something harmful to the pregnant woman. And I always ask students and R.M.Ts what their fear is in relationship to doing deep work in the sacrum. And often people have no clue. They just know that their teachers told them to stay away from that area, and so they do. And many instructors are still teaching no fascial work to the low back in a pregnant woman. And again, my question is why? The most common answer that comes up is, well, the ligaments aren't stable and they've got relaxin, but women don't just melt on the street because of their lax, unstable ligaments. So if you are applying your concepts of technique in appropriate ways, I really find it hard to believe that you could do anything to destabilize the joints in the body if you are listening to the client and being very mindful of the amount of pressure that you're using in that area. What we learned in 1985, back in the dark ages, was that if you worked on the sacrum, the nerve plexus, the sacral nerve plexus was under the sacrum, and you could potentially cause a reflex effect to the digestive tract or to the reproductive organs. And that, to me, at least makes a little bit of sense. But we don't know if working on the sacrum would help to calm the nerve connection to the digestive tract and the reproductive tract, or whether it would stimulate it. And it's a very hard thing to try and get some money to do this as a clinical study. So again, if you think that pregnant clients are going to chiropractors and having manipulations and adjustments in their sacral area, ask yourself if what you are doing in that area is as aggressive as the most aggressive or assertive activity that client is doing. And I think that might reassure you. women who are pregnant have 50 to 75% of women who are pregnant have low back issues. So it's a terrible thing just to ignore that on them. The one proviso I would say on this is with our really high risk pregnant clients who are in the hospital, 23, 24 weeks, their membranes have ruptured, they're bleeding, they're at imminent risk for delivering at a time that's just very vulnerable for the viability and survival of the fetus. For them, we will work lateral to the SI joint in the glutes, around the greater trochanter, those strong fleshy muscles we will work. We're not working in any proximity to a depth that would access the QL. And again, the way I explain this to the clients is there's absolutely no evidence that we can increase harm if we work in that area, but we are erring on the side of caution. And 25 years in, somewhere during that time frame in the hospital, we figured out that if we relax the glutes and the piriformis and the attachments around the greater trochanter, we can actually have a good effect in reducing low back pain. So it's a win-win situation for everybody. So there's that sacrum. The other thing you might want to know about the sacrum is where the sacral foramina is. In terms of Chinese medicine, they are meridian spots that do relate to birth and pregnancy. Again, I don't practice Chinese medicine, so I'm not even going to go into this at any depth. But again, essentially, you'd have to either have your fingers in those foramina in sustained, intentional activity, or doing some kind of acupuncture in those areas. And those of you who do practice acupuncture or acupressure as a modality would know what's appropriate within your scope of practice for that. So the average R.M.T is not going to be doing anything that's going to stimulate birth or labor. For the tummy, yay to the tummy. And so many people who come to our courses, even if they've had a lot of work with pregnant clients, they are not doing abdominal work. And that just really makes me so sad, because what's a pregnancy massage without an abdominal massage? So you have to be comfortable doing it. I love doing it. Clients love it. I've had women drift off into deep, deep snoring sleep while I'm massaging their belly. I had one colleague, she said she would go to bed and her husband would be massaging her abdomen and talking to the baby, and she'd be snoring away. And she said that was their little playtime together. She said, I was completely oblivious to what was going on there. But again, if you think of pregnancy as, for many women, as an anxious time and a fearful time, massaging the belly in such a nurturing and loving way can just do so much to help connect them to the joy of being pregnant. And many, many women are completely sold on the tummy massage. So I'm just going to go back here. So the reasons, you need to know and explain the reasons for doing tummy massage. So my pressure is usually gentle but firm. I don't go deep, deep in my belly massages. It helps to work with the skin that gets overstretched and is itchy. I call it baby's first massage, first professional massage. And I explain that I always do the treatment in a clockwise direction, which is the same direction they're going to massage their baby's tummy in when the baby is born. I recently had a client who his baby is postpartum, and because of COVID, I didn't get to teach her baby massage, or hadn't seen her or the baby for a long time. But I asked her if she'd been doing any tummy massage or any baby massage in general. And she said, well, I do the one on the tummy, the circle one that you told me would help with the movement of gas and food. And I was just so thrilled that within her own massage therapy session, she remembered that to apply that to her baby. So the other thing I would suggest is, if you have the opportunity, go with a client or a family member or a friend to an obstetrical or a midwife visit and see the level of palpation depth that they do with their clients. And I don't do anything nearly as deep as what they do when they're trying to palpate position of baby and so on, and the fundal height. So what I do find is when I do my demonstrations of abdominal massage, if I have a pregnant R.M.T as our demo model, they often will show us what they are doing, and they're often going much, much deeper than I do. But again, if for me, it's the pleasure of connecting mom and baby, reducing stress, soothing, calming, reassuring. The other thing I would really reinforce, it is not in your scope of practice to determine where the head is and where the bum is. If sometimes that gets missed with clients who don't have ultrasounds up until the time of birth, it is completely unprofessional and inappropriate for you to guess the baby's position. And many clients will ask you while you're doing the massage, can you tell where the head is? And I always say, no, it's not part of my scope of practice and I'm not allowed to determine that. But do you know where your baby, how your baby is positioned? And then they can tell you. That gives them the power to be able to have some confidence that they know about their own pregnant bodies. So back to this slide, this is a pregnant R.M.T and she's doing erectus abdominis, some trigger point work and working in the costal border there. And she had issues with reflux and she said working these points were so incredibly relieving. So you can see how deep she's working on her belly. I will do costal border muscle stripping, but I don't generally go quite as deep as she is going here. And again, some close-up pictures of how she's in the belly. So please do abdominal massage. It's wonderful for pregnant clients. So next, is pressure contraindicated for pregnancy? I hope this has sort of become self-evident. This picture isn't really going to answer the question because it's flat-handed and it's rhythmical and it doesn't look very deep. But then you've got our elbows, our forearms, those glutes need deep work. The ischial tuberosity needs to be relieved. And so knuckles, elbows, forearms. The issue with pressure is what is the client's experience with massage? What do they like? Watching their cues, checking in with them, finding out afterwards how they did with the session. So long as you are communicating well with your clients, the pressure should be relevant to their goals and their needs. Hydrotherapy during pregnancy, what are the considerations are what kind of hydro you're talking about, the temperature of the modality, and then the effect of the modality. So pregnancy is not a time for pregnant people to want to do a detox. So things like saunas and jumping in snow or doing any major hot, cold, systemic type of effect of hydrotherapy would be contraindicated during the pregnancy. They can do it in preparation for pregnancy, but not during. Generally speaking, many pregnant women, not all, but many are already overheated. Their hands and feet can feel like little furnaces. So many clients don't actually want a lot of heat when they are pregnant. So I stay away from using thermophores. I might use a heat pack on a shoulder or a glute muscle, but generally speaking, no full systemic kinds of heat. So the core temperature of the body is 38.3 degrees centigrade or 101 degrees. And this quote says, saunas, hot tubs, tanning booths can raise the body's core temperature. So that would be a no-no. It says, do not raise the mother's core body temperature above 104 degrees or that's Fahrenheit or 40 degrees centigrade, because this could be dangerous to the fetus. The time that it seems to be most concerning is in the first trimester, when the fetus, the neural development of the fetus is occurring. So, and generally speaking, again, if women like taking hot baths, I will refer them to their midwife or their obstetrician for guidance on how hot is hot, okay? So what does massage therapy do with or for the pregnant person? Well, of course, we've got these muscles, ligaments, fascia, and joints. And this is what we're working on inside and out. The causal factors of pregnancy discomforts, there's a few listed here: improper posture, muscle strain and imbalance, myofascial trigger points, if you still believe in them, the hormonal effects on the ligaments, the baby's position, and any referred pain from uterine ligaments. So these are many of the things that you will see particular to your pregnant clients. I'm going to just go through this very quickly. So we know we relieve stress. We know we promote relaxation. We know we work on the musculature, the fascia, the muscles, the ligaments, so we can help with muscle cramping and pain and restricted muscles. In terms of the circulation with edema, I would say lymph drainage is probably the most effective tool for helping to relieve that and the hydrotherapy I mentioned of jumping in a lake. Massage also helps relieve the stress on the weight-bearing joints, and the weight-bearing joints, if you're upright, are your ankles, knees, hips, low back. If you're stuck in bed because of a high-risk pregnancy, the weight-bearing joints become the hip joint and the shoulder joint, and they often take a beating with women who are on bed rest for significant amounts of time. We provide emotional support and nurturing touch. And again, the fact that we spend an hour and a half with our pregnant clients is a gift. They get to talk or not talk. They get to share. They get to ask questions, often in a way that they don't get anywhere else except maybe their partner if they have one. Sleep is always a benefit after massage. Our hospitalized clients always tell us they can't believe how much longer, how much deeper they sleep after the students work on them. So I'm quite confident on the effects of massage therapy to help relax and encourage sleep. And then I always encourage you, every time you work with a pregnant client in your clinic, to think about some component of the treatment that helps with the preparation of the birthing process for them. We work from a risk-benefit model, and if you're talking to midwives and obstetricians about the work that you do, they like to hear that language. We are not trying to interfere with medical treatment. We are offering an adjunctive modality. So for instance, women who find that their headaches are increased during pregnancy, working those suboccipitals, scalenes, levator, traps can be amazing to help relieve some of that forward head carriage, and may in fact result in them not having to take medication, which is often frowned upon in pregnancy. You can teach them breathing and relaxation techniques. You can teach them exercises that prepare them for birth, and you can always help alert them and remind them about the postural changes that occur in pregnancy and help them with strategies on how to minimize some of those effects. So your job is to find out what the client already knows and is learning and is doing in their life, and then encourage them and reinforce them and teach them any new skills that might help them have a better, happier, more relaxing pregnancy. Sometimes you're the listener of their woes about their care provider. Again, your job is to just listen and try and be non-judgmental, but I once had a woman come to my door. She was at 28 weeks and she came to my door, and I opened the door and she burst into tears. And she had just had a glucose tolerance test and had been told that she had gestational diabetes, and they wanted her to do all this these things, and she was just beside herself because she felt completely well, and this kind of hit her broadside. So by the time she had her massage and got to talk about it and everything, she left feeling a lot calmer and a lot more together, related to what she needed to do in terms of taking care of this issue. You can teach.
Are we, is this the last slide, or do you have a lot more? Because we're a few minutes over time, and I just wanted to see where you're at.
Let me just, I think I can skip most of this. I want to just do this really quick, Amanda. This is self-care, okay? Many RMTs are so afraid to give self-care. Look at these women. Look at what they're doing. Look at their alignment. Look at their creativity. So don't be afraid to give your pregnant clients self-care. And then just to see the end result of the joy of working with pregnant clients. And if you do get to attend a birth, it's an incredible thing. And I had some books to share. You can email me if you have questions. We run courses. You can go on our Facebook site and see dates. And thank you so much. There's my contact information. And if there are questions, happy to answer them.
Okay, so Cindy, there is a question on Facebook. So when we're wrapped up here, we can chat and you can go over there and answer them on the Con Ed Institute Facebook page. There was only one question in the chat here, just to confirm. I think you can answer this with a yes or no. You don't suggest doing 5 to 10 minutes of supine, even if their torso is elevated with pillows and the right hip is bolstered, taking into account asymmetry of the hips.
It's a complicated question. I think the therapist has to make that decision. I don't go by time. I just 5 minutes, 10 minutes. It doesn't, I want my clients, if there's any chance that the weight of the gravid uterus could compress the blood vessels, I want them sidelined.
Okay, well, thank you so much, Cindy.